Welcome back to OpenLine. Our topic tonight, children's mental health during the pandemic. And of course, our realities within the pandemic have continued to change as this has moved forward. At the very beginning, many of us were staying at home, safer apart, as the phrase went. Obviously, some things have changed as we've gotten a better understanding about how this virus moves, about the impact that the vaccine has had, and as a lot of factors of society have reopened. So I wanted to ask our guest tonight, Dr. Tanguturi from Vanderbilt University, as we've progressed in kind of obviously we're still in the pandemic, but maybe a new phase of it since the vaccines have been introduced. Has that changed any of the impact that it's had in children's mental health in the last year, or is it, as this pandemic continues, does that largely remain the same?
I think the first year was strange in that there was still a lot of things that were really fresh and new. So I think a lot of us still did not understand kind of what was going on in some ways. Earlier, we were kind of talking about the increases in the number of kids presenting to the emergency room. And interestingly, in the first year, especially around the March, April kind of time frame, the number of kids actually fell down really low, and it's kind of gotten back up. But I think that was probably a reflection of the fact that things were still fresh and new. I think what this year has kind of shown us is that unfortunately we are in for maybe a little bit of a longer haul. Maybe we are going to be COVID's going to be around for the next year at least, and so the problem or the challenges that we are facing have become a little bit more clearer. But the converse to that is that we also have been forced to come up with solutions that kind of are better, right? Like, so a good example is just like we are talking about mental health needs and the number of kids that have need for services. Over the last year and a half, a number of like mental health services have been able to kind of expand into the telehealth kind of domain. So a lot more kids are able to kind of see providers even from their home. A lot more, are able to access services like therapy, services like medication management for psychiatric illnesses. So all of that is kind of like, I guess, a net positive change that has come out of the pandemic for sure.
Absolutely. And to that point, I also have to imagine, because I know a lot of us, even on the adult level, maybe, hesitated to even go to their well checkups when everybody was staying safer at home. I'm sure the amount of patients you actually saw come in probably were impacted by the fact that there just wasn't a lot of people moving and getting out, especially early on.
Yeah, definitely in the early days of the pandemic. But thankfully, the vaccines have kind of changed that a little bit. And most schools are open, and most kids are back in school, which again, like I said earlier, overall is a good thing.
Absolutely. You mentioned telehealth, and I think that's such a fascinating topic, because I know that has to be a huge change in all facets of the medical community. Do you think telehealth is really helping expand access to medical coverage, especially for groups that it may be harder to be able to get those services to them?
Absolutely. I think, as psychiatrists and mental health providers, we have had to embrace telehealth because it has been it has been something that has been remarkably helpful in the pandemic. Telehealth is like one of what I think is like a set of things that we probably need to be doing moving forward, in terms of like access to care and having more services. Some of them are increasing the number of providers. Obviously, there's a whole the mismatch between the number of patients needing care and the number of providers is still pretty high. So increasing the number of providers, having even within telehealth, there's a lot of regulatory kind of stuff that was initially relaxed, so that telehealth could be expanded. So things like insurance companies, things like other compliance kinds of stuff was relaxed, and that was kind of like a model moving forward for us. And just more awareness among parents and schools and other caregivers is also really going to be important moving forward.
Absolutely. I'm sure there are viewers watching this tonight that may be, considering or at least thinking about therapy. When does my child or my grandchild or a child in my life need to consider sitting down with a mental health professional or someone like you? What are some of the factors that parents should consider in making that decision?
Yeah, definitely what we talked about earlier, meaning the severity of illness is going to be a big factor. Any kid who's having some of the more extreme symptoms, especially things like dangerousness to self or others, things like aggression, things like suicidal thoughts, suicidal behaviors, self-harm behaviors, those are all kind of like, immediate calls for treatment and things like medication and therapy. But just in general, some of the targeted care can be focused on some of the distress that kids experience, and therapy can really help with like providing increased support, providing guidance to strengthen what we call coping skills. All of us have some form of coping skills, and kids especially, that's like a big skill they learn during their developmental kind of stages. And so any kid who is kind of struggling to cope with some of the stressors that are going on probably needs or can benefit from therapy to help with that.
Of course, we've been talking all night about how there are so many ripple effects that the pandemic has laid its tentacles on, whether that's from social isolation, education. But one part that we haven't gotten to, at least yet tonight, is the economic impact. Obviously, that may not directly impact children in occupations, but obviously if their parents were laid off from jobs or, underemployed or families went through major economic changes, what kind of impact can that have, maybe even unintentionally or unthought of, on children?
It's in my line of work, I actually see that quite often. I might see kids coming in, whose parents just lost their insurance because they lost their job. So access to care becomes way more difficult. In addition to that, there's also like this whole element of like the more economically disadvantaged kind of kids also have a good example for that would be like when lockdowns were happening and kids were staying home from school, not all kids had access to laptops where they could connect to do their their remote education through. So a lot of those problems kind of came up as well.
Absolutely. We've talked a couple times tonight about how obviously things can progress when it comes to more severe mental illnesses. When it gets to that step, what are some factors that parents need to probably keep in mind as they're, talking with their doctors about plans to be able to assist their children with that?
Yeah, so definitely getting evaluations from like qualified mental health providers. There's a number of different ways to kind of access that. The probably best way that works for most people is like through primary care providers. So like pediatrician offices would be a good place to kind of seek out referrals. Obviously, if there are like dangerous, like we talked about some of the more severe kind of indicators, then the emergency room, other kind of crisis hotlines, suicide hotlines, those are all like really useful resources also. Schools are a really valuable resource in terms of identifying some of the problems that are going on, problems along not just in the mental health domain, but also like in the education domain that kind of go hand in hand, and kind of interventions to target that as well.
One thing I imagine you have to encounter a lot in your job is the stigma that still surrounds mental health. And I know that there have obviously been advancements over the years, but would you say we're still probably not quite where we need to be when it comes to fighting that stigma?
I guess there's always room for improvement for sure. But like you said, I'm always constantly surprised by how much that continues to change in a positive direction. That I see more and more parents investing in that treatment, investing in kind of like developing some of the mental health, and kind of this concept of like resilience that we talk about for kids. a lot more attention is being paid to that, and so that's definitely a good sign.
Absolutely. And to that end, to just kind of continue that one question more, do you feel like enough resources are being pointed in the right direction when it comes to mental health, and especially when it comes to insurance plans? You mentioned before, obviously, the impact of, how economic situations can impact children and losing insurance. Are we where we need to be when it comes to coverage for mental health?
Yeah, I would say definitely not. There's a lot of room to grow and a lot of opportunities for it. I think it is one of those where we can continuously get better, but the problem seems to grow bigger than the rate at which we seem to be getting better. Just recently, some of the main professional organizations in our field, the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry, have both kind of released statements calling this kind of like a crisis moment for us, in terms of the need and more attention, and this is something of an emergency where we need to act and act fast and act kind of decisively, and a huge part of that is improving resources and access to care.
Absolutely. As we've talked about a couple different times tonight, I know that it's hard to really know what the long-term impacts will be, especially with this specific pandemic. But you have also mentioned that we have other elements in history and other references in history to compare this to. So I'm curious, what do you think might be the generational impact that the pandemic may have on children, that have grown up in it? Is it going to be like, I know my grandparents, their reference point is also always living through the Depression. Is that going to be something similar for children of the pandemic, for lack of a better phrase?
Yeah, quite possible. I always wonder about, I'm a father of a 3-year-old, and I've been wondering a lot about the impact of masks, right? She's been wearing masks since she was 2, and I don't think we have a great understanding of how that's going to be. We know, as experts in child development, we know that a lot of kind of communication, a lot of understanding emotions, all of that does get affected by that. But how that's going to be is an interesting question for sure.
That's a fascinating topic that, truthfully, I'm jealous I didn't think of when I was kind of writing out my questions tonight. When it comes to that, because obviously so much of our communication, in addition to what we say, is what people see and facial expressions and that sort of thing. So, is there a way, if you have parents that are watching that have children that are, wearing masks in schools, of kind of talking with your children about that and making sure that they're still getting that element? I guess they get it at home if they're not wearing a mask, but I don't know, that's an interesting topic to kind of delve into a little bit.
Yeah. I think for the younger kids, it's still kind of hard to understand what it might be. But for some of the preschool and a little bit of the older kids who are still in kind of elementary grade levels, for them, I think it's really useful for parents to kind of sit down and kind of talk about it and kind of this is something we're all doing to kind of protect ourselves, but continuing to do some of the things that are going to help in the long term, which includes, spending time with kids, checking in on feelings, spending a lot more kind of time, doing things like reading and communicating, being a good model for how to cope with this time is going to be the most important thing, because most things that kids learn, especially in this domain of resilience, are going to be learned from watching their parents deal with things as well. So.
Absolutely. We've talked about how the impact of children when they have a loved one that's impacted by COVID-19. I'm curious, maybe even just anecdotally for you, have you had situations where the children themselves have had COVID-19 and that has had, an impact on their mental health?
Oh, absolutely. I was talking earlier about kids that are kind of, waiting for a bed, presenting with psychiatric complaints. They need an inpatient psychiatric bed. and there's plenty of patients we've seen who, at the same time, when they walk into the ED, test positive for COVID, even though they don't have any symptoms. And children by and large don't have a lot of major symptoms, and so then they've had to like quarantine in the hospital for 10 days before even getting a psychiatric bed. And I can only imagine the effect that isolation, that kind of period of quarantining, can have on their mental health as well. So it has been pretty complex, and it still continues to be that way. Still, kids are presenting with like positive tests and having to isolate or quarantine even within the hospital.
Absolutely, and you and I have talked about this a little bit. It's come up in our conversation, I should say, but obviously we don't really know what the next few years look like either. If we obviously, I think, know that COVID-19 is going to be a part of our lives in some ways, and our masks are probably not totally going away anytime soon. So how do you have a conversation with maybe even older kids that may be starting to get a little frustrated, going, okay, we're not back to what normal used to look like? And I mean, obviously that's a tricky conversation for adults to have, but how do you approach that topic with your kids?
Yeah, I think for the older kids especially, I think being very open and honest, and kind of being able to validate some of the feelings, that it's appropriate and normal to kind of have these feelings of frustration. It's normal to kind of have feelings of sadness and sometimes loneliness during these times, and kind of modeling what like healthy coping responses to that will be. I think that's going to be the most important thing for older kids. In general, kind of this concept of like, you're not alone, we're all kind of in this together, and kind of, this is something we're all doing together to kind of protect ourselves, emphasizing those themes. And kind of the other element to that is obviously, I think for lack of a better word, we need to be optimistic. We need to be positive about the future, and like, think about, 5-10 years ago, people were kind of talking about like, oh, what's going to happen if there's a pandemic? And what happened after a pandemic is that within 10 months we had a vaccine. And we continue to do things that are good. And I think overall you have to continue to focus on the positive, and kids respond way better to positive messages than anxiety and fear.
And also just to bring it up, because I think it's obviously such a big factor in the world that we live in right now, is there's also a lot of contention about disagreements between adults that probably filter it down to kids about what the right steps are for those of us in the pandemic when it comes to vaccines, when it comes to masks. The temperature is pretty high. I know of a teacher that is in a school district where parents can opt them out of masks, and so then you have kids doing different things and confusion, especially for younger ages. How do you have that conversation with kids in your life about, kind of just the state of politics and the state of just where we are right now in this stage of the pandemic?
Kids are sometimes fun in that they don't care about politics, which is something I do like about them. I think no matter what your politics are, as long as you're modeling some of the healthy behaviors, modeling some of the healthy ways of communication, for younger kids, I think it makes sense to even kind of limit some of the exposure to this like negativity and anger that seems to be in politics right now. So limiting some of that, but for older kids, kind of modeling how you process feelings around it, what is a healthy way of dealing with it. You may have an opinion that's different from what is being reflected somewhere, and kind of talking about like, hey, these are the reasons why I choose to do this, and having like open and honest conversations. At the same time saying, different people may have different beliefs, and that's okay, and being able to validate some of that is going to be, really important.
Absolutely, a great point, Dr. Tanguturi. You will have one more segment after we get back to have a chance to call in with your questions and comments. Feel free to do so. Join the conversation with us if you'd like. We will have one, like I said, one more segment with him after this break.